of Mindanao. Today, I will be showing you my return demonstration in performing Leopold'S maneuver. This assessment is a four-part process where we can identify the presentation, position, degree of descent, and of course, the attitude of the fetus. We can also determine the number of the fetus and of course, identify the points of maximum intensity of the fetal heart rate in relation to the woman's abdomen. The materials needed are the tape measure to scope and the pillow of the patient. Check the client's chart and read the doctor's order for the patient's procedure. Explain the procedure to the client and do the assessment. Obtain the obstetrical history including the parity for gravitas score, LMP, EDG, and AOG, and fondic height, and take the vital signs. Hi ma'am, maayong adlaw. Ako di si RN yung niya, ay imong student nurse karong adlaw. Matanong ma'am sa iyong pangalan? Tasha Alparo. Kabila ka naman. Kaduha. Napa kay abort? Wala. Premature? Wala. Kano sa imong last menstrual, ma'am? September 6. Instruct the client to empty her bladder before performing the procedure. Gather the needed equipments and check for its completeness. Mana kang panghi, ma'am? Oo. Mana? Ayun. And do hand washing prior to procedure. Provide for the client privacy. Place the woman in dorsal recumbent positions or supine with the knees flexed to relax abdominal muscles. Drape the client using the top sheet blanket exposing only the abdomen and place a pillow under the head. Sure that the hands are warm before coming in contact with the client abdomen and rub the hands together vigorously to present uterine contraction and the palm of the hand instead of the fingers.
First maneuver, fondal grip, using both hands and facing the client feet for the fetal part lying in the fundus. Determine the shape, size, mobility, and consistency of what is being palpated. Findings: head is more firm, hard, and round that moves independently of the body. Breech is less well-defined that moves only in a conjunction with the body. Second maneuver, umbilical grip. One hand is used to steady the uterus on the one side of the abdomen, while the other hand moves slightly on a circular motion from the top to the lower segment of the uterus to feel the fetal back and the small fetal parts. Use gentle but deep pressure. Repeat this step on the opposite side using the opposite hand. Findings: fetal back is smooth, hard, and resistant surface. Knees and elbows of fetus fill with a number of angular nodulation. Third maneuver, Pollick's grip. Using thumb and finger, grasp the lower portion of the abdomen above symphysis pubis. Press in slightly and makes gentle movements from side to side. Findings: the presenting part is not engaged if it's not movable. If it's not yet engaged, if it is still movable. Fourth maneuver, pelvic grip. Facing the foot part of the woman, palpate fetal head pressing downward about 2 inches above the inguinal ligament. Use both hands. Findings: good attitude. If brow corresponds to the side second maneuver that contain the elbows and knees. Poor attitude. If examining fingers will meet an obstruction on the same side as fetal back, hyperextended head. Also palpates infant's anterior-posterior position. If brow is very easily palpated, fetus is at posterior.
Place the client to its proper and comfortable position. And do one hashing. And do hand washing. And document the procedure and assessment during the care. And document the procedure and assessment during the care.